Alexander Schachinger from Germany, Tim Lloyd from the UK, and Jorge Juan Fernandez from Spain. And they're each going to give a brief presentation, at which point we'll have a little panel discussion. So, Alexander. Do you have your...
Hi there. Hi there, ladies and gentlemen. My name is Alexander, and I talk about e-patients and the potential of the integration of e-patients into the healthcare Medicare system. And I conducted some e-patient research and surveys throughout the German-speaking countries. And I read a lot of this stuff. I still try to finalize a PhD on Health 2.0. And so I tried to figure out some impressions. What is this about? We had a lot of these potentials, a lot of these tools, a lot of these things that are possible. But if we go back and see what's the learned culture of marketing, of selling, what is the learned culture of economy since Henry Ford, it's right the opposite of the book of Clue Train Manifesto that Denise said. It's right the opposite of these potentials that the book from Clay Shirky, Here Comes Everybody, says. A global conversation has begun. All these things that are possible, right, and that are in front of our doors and that end users are doing outside and independent of organizations is totally not the learned paradigm of marketeers, brands, organizations, especially not in the healthcare industry, as you know. So it's a collision. It's a collision and a clash of cultures of these two paradigms. Controlled mass media cathedral, and here we have the bazaar, we have the openness, we have the sharing, and so on. So how can we put that together? It's a very long learning, I think. And we have learned a lot that patients, doctors learn among each other, independent of institutions. We learned a lot that a connected patient learning from each other is the best value, the trusted value, because they have the same situation, same problems, and they speak the same language. So that means if you listen to it, if you listen to patients, if you listen also to doctors and others in general, you can learn a lot of your products, of your service, and especially if you see in digital, advertising comes from advertising to service. Service is more important. And I heard many people, we need an app, we want an app, and we do any app, and it goes not into the need and the agenda of the target group. Then listening is the simple thing, but it's not used. They simply, managers, marketeers, mostly don't do it. So what is the ROE of this thing, and what is the impact? And I mean, the example of the pharma industry sends out the sales reps to the doctors, prescribe our products, please. And if we talk with pharma, they say, well, there is no impact. And we did a survey with about 1,500 e-patients in Germany. And I wanted to get to the point. I want to find out, is there an impact, a real economical impact on the brand, on the product, on the market, even in the RX prescription area. So the result is the second line, roughly 18% of the e-patient, yes, it's more the active ones, it's more those active ones who are participating in forums. Roughly 18% of them get the prescription from the doctor they want based on online information. So all the brand managers of pharma companies say, damn, right? There is a new impact. And there was one company, on a small innovative country like Denmark, Coloplast, and they did it for the first time. I know this only case. They put up a stoma innovation campaign and website and community with stoma patients, existing and ex-stoma patients. And Peter Craig presented this thing in Switzerland, in Zurich, a couple of months ago, and they had huge insights how to improve the product and the service all around this stoma Medicare thing. And here you have a really answer of the use question, well, what is the ROI of all this digital healthcare, social media thing? You can answer this question with another question. So, Mr. Berbenicher, what is your ROI on market research and development?
Thank you for the opportunity to be here today. Thank you, Denise, for pulling this all together. I suspect that I might be somewhat in the minority as a sort of a representative of government, of the public sector here. I know that there are others, but but I suspect I'm in a minority. What I wanted to do was really give you a sort of a brief update, a brief taster of some of the things that are happening in the UK in terms of social media and its relationship with patients and with doctors. What I've heard a lot of while I've been here the last couple of days, and indeed, in my sort of my travels in the course of my job, is that frequently I hear that the Department of Health, the NHS, has sort of banned social media, that we don't do digital, that we're not really online, not really engaging with patients, and I don't think that's sort of a fair assertion. Although I think we're far from perfect in what we do. We've got NHS Choices, which is, along with NHS Direct, a sort of official health information portals for UK patients. And within that, there are apps to help you monitor your alcohol intake and ensure that you sort of stay within the limits. There's also a symptom checker that, again, you can download to your smartphone. And there's some really interesting evidence behind these to sort of demonstrate significant cost savings by helping patients to live better and almost diagnose themselves online and avoid costly interventions in hospitals and in doctor surgeries where perhaps it's not always necessary. I really enjoyed John Mack's workshop yesterday. I don't know if John's here this morning, about social media policies. On the face of it, policy around use of social media is not the most sort of exciting aspects of the things that we're talking about here, but I do strongly believe that until we get those sort of corporate social media policies right, it's very difficult to instill the necessary confidence in healthcare staff to use those tools.
My name is Jorge Juan Fernandez. I know you have difficulties with the J's. And I am the director of eHealth and Health 2.0 at Hospital Sant Joan de Déu, Hospital of Sant Joan of God, which is a maternal and children's hospital in Spain, based in Barcelona, the largest children's hospital in Spain. And the last I'd say 10 years or 8 years in Spain, all the talk about technology has been about electronic health records, which basically are a masturbatory game for IT departments, okay? So when all this revolution and all those disruptions started, we decided that we have to do things for the patients, okay? Because we always say they are the center, but all we do is for ourselves or for the physician. So we decided to put the patient in the center. What did we do? We read something that I really, really liked, and I'm going to copy that from a neurologist of the US, who said, much of what I do as a physician could be better done by either machines or patients themselves, okay? So we thought that was a good starting point, and we created what we call the liquid hospital, okay? H2.0 hospital, with the idea that probably hospitals together with prisons were the last institutions to open themselves to society. So for us, Health 2.0 is a part of something bigger. That what we're trying to do, we're trying to get the hospital near the patient. So we use smartphones, the web itself, we do telemedicine, we have our platforms, and we work also on Facebook, Twitter, and the likes. The normal telephone, mobile devices, the email, and other medical devices. This is the scope of the project. We do 4 things. We do e-health, social media, web portals, and virtual settings. With e-health, what we do is what we call telecare and telemedicine. We imagine a future where the digital record, the digital health record of the patient has also the presence, the visits that he has, but also all the online interactions. It doesn't make any sense, okay, to have the digital interactions on one side and the presence on the other. What is happening now is that our doctors are using emails a lot. Emails in Spain, our law doesn't allow them to, it's not safe to use it. Skype isn't either helpful, okay? So we have to create our own company to do so. So social media, what we do is we use the general platforms to spread our messages to the population. We also have created 3 web portals that we do so. The difference between both of them is that in social media and general platforms, we don't own the databases. Here we own the databases. And also we do some virtual settings. I was going to say something more. We're the first hospital in Europe, first and only so far, that has created a social media policy. We've been here working for a year already. So we created a social media policy to establish some rules and guidelines for our physicians and our patients as well, number 1. And number 2, we created what we call participatory guidelines for our team to work with other institutions and other, let's say, other parts of the other departments of the hospital. We don't believe that any 2.0 stuff is something new. We have to create ourselves into the existing processes. And there's been a lot of talk about business models. I'd like to end up with a reflection. You know, this is a revolution. We have to look at revolutionaries before, what they did. And I remember that clearly, that Martin Luther King, he said, "I have a dream." That's what he said. He didn't say, "I have a business plan," or "I have calculated my ROI," okay? He said, "I have a dream," okay? So I think we should go for that.
I just want to follow up on that issue of revolution. When I started on Twitter in 2008, I was just amazed at how much hope there was for social media and improving healthcare. And if you look at Ed Bennett's data from the U.S., you know, we had this very, very early precipitous spike in hospitals coming on Twitter and Facebook, and then we had a more realistic leveling off. Just a question to the panel. Do you think we've really lived up to the promise of Health 2.0, or are we all in a bubble here and on Twitter and on the little filter bubbles we create on Twitter? Lucien, do you have thoughts about that?
Well, I think that one of the aspects that we don't have to forget is that there's a hype cycle as well. So looking for that, the thing that Gartner predicted is it goes over the top into the thought of enlightenment and then gains up again. And I think we are only at the beginning of this revolution, actually, where social media will be a very big part of it.
I think it's an important point that Tim made, and this came up yesterday, this issue of celebrity. I was talking to Gilles about this yesterday, Gilles Friedman, and we were talking about the issue of e-patients and patient celebrities. And one thing I've noticed is while we see these patient evangelists, not all the patients that I encounter want that level of engagement and involvement. I think we forget that there are cultural differences and age differences. And some of my patients want a more paternalistic approach. I mean, there's no question about it. We don't like to hear that, but it's just the way it is.
I think that's the difference between publishers and consumers, and having that one sort of rock and roll rock star patient is a good case study, but it's not a solution. And there's a great deal of patients out there who want to sort of consume information using the web, but they don't necessarily want to republish it or share it even themselves.
I just came from Maastricht. Seems like it's the center of the world now. Just came from. It is okay. You got no corn tower. So in Maastricht, they had a meeting until yesterday. It was the International Shared Decision Making meeting, and it was about how do patients and clinicians make decisions together. And one of the things that this movement has realized, again, it took that 7 years, is that, as you said, not everyone wants to have active participation, but what is absolutely necessary from the health professionals is one value, and that is empathy. And by being empathic, the health professional can dance with the patient and decide that for this decision, at this moment for you, you are going to be more participatory, but for the next decision or the next time we meet or the next, you may like a different style. And it is the clinician's role to be empathic, to be able to figure out to what extent give and pull back on that participation. And the same thing may apply to this medium.
Lucien talked about technology, and probably I think the biggest challenge in getting doctors on board is going to be integration of some of these social technologies with workflow. I mean, there's a push to get doctors onto mobile, and we see all these physician verticals kind of appearing. And I mean, the question for me is, how many places can a doctor live? Can a doctor live on Twitter, Facebook, sermo. Victor, what do you think of that? I mean, how many digital homes can a doctor have, really?
Most of the physicians that I know, and I will count myself in it, barely have time for their family to know who they are anymore. And so it's almost unethical parenting for me to spend time on Facebook, Twitter, or wherever, rather than with my children when I come back from work. And then finding time to do it while at work potentially cheats associates, cheats patients that could be using that time to see me. And that is a reflection in part from the fact that my practice is not online, so to me it's still a separate part of my professional life. Mm-hmm. It's different from Lucien's colleagues, John Kremer, whose practice is in a big way online. So for him to be on that particular home is just part of his professional life. So I still have a personal and a professional that are separate, so that's a personal challenge. And the second thing is, but I think for many of the clinicians that I know, many of the physicians that I know, the balance of work and life and time is a challenge, and for them being networked is not a core component of their profession. So one of the maturation signals that we may get, somebody mentioned, I think it was Denise, that if people are using credit cards, the thing has arrived. Another potential for healthcare professionals, I suspect, the marker that this thing has arrived may be when clinicians start seeing this as part of their daily routine, of their practice, not as part of their life. And therefore it stops competing with the life of being a father, a parent, a member of the sports team in the community, and it starts being part of what we do on a daily basis.
Well, unfortunately, we're out of time. I think we could probably go all afternoon having this conversation. There's so much to talk about. But I think we're going to break for lunch now at this point.